So students, in this lecture, we are going to overview hypertension. So before going into detail of the hypertension, we will discuss that what are veins, what is another name of veins, what is capacitance, and what is transmural pressure, because these are the terms which we are continuously going to use in our future lectures. So what are veins? Another name of veins is the capacitance vessels. Why we call them capacitance vessels? Because these are the vessels which contain 60% of the body blood volume. Now, the return of the blood to the heart is assisted by the skeletal muscles. Basically, whenever there is movement of the muscles, these muscles will squeeze the veins which are running through them, and this squeezing will actually help to return the blood to the heart. So we can say that this return of the blood to the heart is actually assisted by the skeletal muscle pump. Why we are calling it as skeletal muscle pump? Because when you are moving, when the muscles are moving, this movement of the muscles is actually squeezing the veins which are located or running through them. So now what is capacitance? Capacitance is actually the volume of the blood that is inside the vessels, that is contained inside the vessels in relevance to the transmural pressure. Now what is transmural pressure? Transmural pressure is actually referring to a comparison. Transmural pressure is actually the pressure that is inside relative to the pressure that is outside. So capacitance, more precisely, is the volume of the blood contained in the vessels for a given transmural pressure. Now, coming towards the hypertension. Hyper means increase. So, what is hypertension? In hypertension, there is sustained increase in blood pressure. So, how you can define hypertension? Hypertension is actually a condition in which there is an increase or there is a sustained increase in systolic blood pressure of greater than 140 mm of mercury, or sustained increase in diastolic blood pressure of greater than 90 mm of mercury. Now, what are the reasons for this hypertension? There is increase in hypertension due to increase in vascular resistance, due to reduced capacitance of the vessels. So, most of our population is actually suffering from hypertension. What are the possibilities what this hypertension may cause? This hypertension may lead towards different diseases. Although some people don't have any symptoms of hypertension, on the other hand, chronic hypertension may lead towards heart diseases and stroke. These heart diseases or the stroke are basically the most prominent causes of death in the world. So you can say this hypertension can lead you towards the chronic kidney diseases, towards heart failure, towards stroke. So this is possibility. If you don't treat hypertension, then this may lead you towards morbidity and mortality. Now, these are two different terms. Morbidity is actually the condition of suffering from the disease, while mortality means mortal. It is a state of being subjected to death. Now, what are the drugs which we use for hypertension? Basically, the drugs which are used to treat hypertension are the antihypertensive drugs, or you may call them as antihypertensives. So, you classify them as angiotensin 2 receptor blockers, renin inhibitors, ACE inhibitors, diuretics, beta blockers, calcium channel blockers, alpha blockers, and miscellaneous drugs. So in case of antihypertensive drugs, the first category is angiotensin 2 receptor blockers. So the examples of the angiotensin 2 receptor blockers include azilsartan, candesartan, aprosartan, elbisartan, losartan, olmesartan, telmisartan, and valsartan. So case of renin inhibitors, the example include aliskiren. In case of ACE inhibitors, we have examples like benenzipril, captopril, enalapril, fosinopril, lisinopril, moxapril, quinapril, pyrindoprid, ramipril, torrentolaprid. So, next category is diuretics. In case of diuretics, we have aminoride, bumetanide, we have chlorthalidone, abiraterone, ethacranic acid, furosemide, hydrochlorothiazide, we have indapamide, metolazone, spironolactone, triamcitrine, we have torsemide. So these are the drugs which are under diuretics. So in case of beta blockers, we have acebutolol, atenolol, pitaxolol, we have bisoprolol, carvedilol, esmolol, nebitalol, we have metoprolol, nadolol, nebivolol, penbutolol, pindolol, propranolol, and timolol. So these are the drugs of beta blockers. So in case of calcium channel blockers, we have amlodipine, clevidipine, tyrosine, we have felodipine, estradipine, we have nicardipine, we have nifedipine, nasaldipine, and verapamil. While in case of alpha blockers, we have doxazosin, prazosin, and trazosine. In case of miscellaneous drugs, we have clonidine, phenoldopan, we have hydralazine, methyldopa, minoxidil, and nitroprusside. So these are all the drugs which are used to treat the hypertension. So students, we can say that we can classify hypertension into two main stages, stage 1 and stage 2. Until now, we are clear that normal blood pressure is the blood pressure, that is systolic blood pressure, which is less than 120 mm of mercury, and diastolic, that is less than 80 mm of mercury. So, in case of pre-hypertensive conditions, the systolic blood pressure is from 120 to 139 mm of mercury in case of systolic one. In case of diastolic, it is from 80 to 89. Stage 1 hypertension is a stage in which the systolic blood pressure is from 140 to 159 and diastolic is from 90 to 99. And in stage 2, the systolic blood pressure is from greater than or equal to 160 and diastolic is greater than or equal to 100. So this was the overview of hypertension.